Histoplasmosis is an infection. It's caused by a fungus. The fungus is called. You can get it by breathing in tiny fungal spores. These spores live in soil. They especially like soil with bird or bat droppings. The fungus is most common in certain areas. These include the central and eastern United States. It's also found along the Ohio and Mississippi River valleys. Many people in these areas have breathed in the spores, but most don't get sick. Your immune system usually fights it off. However, some people do get sick. The severity depends on your health and the amount of exposure. Histoplasmosis symptoms vary widely, making it a challenging condition to diagnose without proper medical attention. This fungal infection, caused by inhaling spores from the environment, can manifest in a range of ways. They range from mild to severe, depending on the individual's health, the amount of spores inhaled, and the duration of exposure. Interestingly, some people have no symptoms at all. These asymptomatic cases are often discovered incidentally during routine medical exams or imaging for other conditions. Mild cases of histoplasmosis often feel like the flu. You might experience general malaise, which is a feeling of discomfort or unease, and it can be quite misleading. You might have a fever, chills, or a headache. These symptoms are common and can easily be mistaken for a simple viral infection. Muscle aches, a dry cough, and chest discomfort are also common. Some experience fatigue that can be quite debilitating, making it hard to carry out daily activities. These symptoms typically appear days or even weeks after exposure to the fungal spores. The delay can make it difficult to pinpoint the exact source of infection. Fortunately for most people, these symptoms usually go away on their own within a few weeks. Rest and supportive care are often enough to recover from mild histoplasmosis. However, moderate to severe cases are more serious and require medical intervention. These cases can significantly impact a person's quality of life and may lead to complications if not treated promptly. A persistent cough with thick yellow mucus is common in more severe cases. This can be accompanied by other respiratory symptoms that make breathing difficult. Some people may even cough up blood, which is a sign that the infection has caused significant irritation and damage to the respiratory tract. Shortness of breath can occur, making it hard to perform even simple tasks. This symptom is particularly concerning and should prompt immediate medical attention. In severe cases, your lungs may fail, leading to a life-threatening situation. Hospitalization and intensive care may be required to manage such critical conditions. The infection can also spread beyond the lungs, affecting other parts of the body. This dissemination can lead to a variety of symptoms depending on the organs involved. It can affect organs like your liver, spleen, and lymph nodes, causing swelling and pain in these areas. This systemic spread is more common in people with weakened immune systems. In very severe cases, it can reach the adrenal glands or brain, leading to hormonal imbalances or neurological symptoms. These complications are rare but can be devastating. Diagnosing histoplasmosis involves several steps. Doctors consider your symptoms, which can range from mild to severe. Common symptoms include fever, cough, and fatigue. In some cases, patients may experience chest pain, joint pain, or a rash. It's important to provide your doctor with a detailed account of your symptoms, including when they started and how they've progressed. They'll ask about your medical history. This includes any previous illnesses, travel history, and potential exposure to environments where the fungus is common, such as caves, bird roosts, or construction sites. Your occupation and hobbies can also provide clues, especially if they involve activities that disturb soil or bird droppings. They'll also perform a physical exam. This helps them identify any physical signs of the infection, such as swollen lymph nodes or a rash. The physical exam is a crucial step in narrowing down the possible causes of your symptoms. Lab tests are crucial in confirming the diagnosis. They check for the fungus in your body. This can be done through various types of lab tests. One common method is to test your urine or blood for fungal antigens. These antigens are substances that the fungus releases, and their presence in your body can indicate an infection. One way is to test your urine or blood for fungal antigens. These tests are often quick and can provide results within a few days. However, they may not always be definitive, especially in cases of mild or early infection. These are substances that trigger an immune response. Your body's immune system reacts to these antigens by producing antibodies. Detecting these antibodies can help confirm the presence of the fungus. Doctors may also take a culture. This involves taking a sample of your sputum, blood, or tissue. The The sample is then placed in a special environment that encourages the fungus to grow. This involves taking a sample of your sputum, blood, or tissue. Cultures can be very accurate, but they take longer to produce results, often several weeks. This method is particularly useful for identifying the specific type of fungus causing the infection. They then see if the fungus grows in the lab. If it does, this confirms the diagnosis. The growth pattern and characteristics of the fungus can also provide information about its specific strain, which can be important for treatment. Other tests look for antibodies in your blood. These antibodies are proteins your body makes to fight the infection. The presence of specific antibodies can indicate a current or past infection. These are proteins your body makes to fight the infection. Antibody tests can be particularly useful in cases where other tests are inconclusive. They can also help determine if you've had a previous infection that has since resolved. If the initial tests are unclear, you may need more. A specialist can help. This could be an infectious disease doctor or a lung doctor. They have the expertise to interpret complex test results and recommend further testing or treatment options. This could be an infectious disease doctor or a lung doctor. They can provide a more detailed evaluation and guide you through the next steps in managing your condition. Early and accurate diagnosis is key to effective treatment and recovery. Most cases of histoplasmosis are mild. They often get better on their own. You may not need any specific treatment. Rest is important. Drink plenty of fluids. Over-the-counter medications can help. These can relieve your fever and aches. However, tell your doctor if your symptoms are severe. Also, let them know if your symptoms don't improve. They can determine if you need medication. Section 5. Treating moderate to severe histoplasmosis. Moderate to severe cases require medication. Doctors use antifungal drugs. These medicines kill or stop the growth of the fungus. The type of medication depends on several factors. These include the severity of your infection, your overall health, and your immune system. Treatment typically lasts for several months. It can sometimes take up to a year. It's important to take the full course of medication. This ensures the infection is completely gone. It also helps prevent it from coming back. Section 6. Presumed ocular histoplasmosis syndrome, or POHS. POHS is a potential complication of histoplasmosis. It affects the eyes and happens when the fungus affects the retina. The retina is the back of your eye and it helps you see. POHS can cause distorted vision or blind spots. It can even lead to vision loss. If you have any vision changes, see an eye doctor immediately. Treatment for POHS focuses on managing eye complications. Antifungal medications aren't usually used because the active infection is usually gone by this stage. However, in some cases, your doctor might recommend them. Section 7. Preventing histoplasmosis. Histoplasmosis is a fungal infection that can affect your lungs and other parts of your body. It is caused by inhaling spores of the fungus histoplasma, which is commonly found in soil and in droppings of birds and bats. While it can be a serious condition, there are several steps you can take to minimize your risk of infection. You can't completely avoid the fungus, but you can reduce your risk of infection. When you're outdoors, especially in areas where the fungus is known to thrive, it's important to stay vigilant. This means being aware of your surroundings and taking precautions to avoid disturbing the soil. Be careful in areas where the fungus thrives. These include places with a lot of bird or bat droppings, such as forests, caves, and old buildings. The fungus can also be found in soil that has been enriched with bird or bat droppings. Avoid activities that disturb the soil, including digging, construction, or demolition. These activities can release the fungal spores into the air, increasing your risk of inhaling them. If you must engage in these activities, take steps to protect yourself. If you must work in these areas, protect yourself. Wearing protective gear, such as gloves, masks, and respirators, can help reduce your risk of exposure to the fungal spores. Wear a mask, as this helps to filter out the fungal spores. A simple mask can provide a basic level of protection, but for better safety, consider using a respirator. A respirator provides even better protection, creating a seal around your nose and mouth. This ensures that fewer spores can enter your respiratory system, significantly lowering your risk of infection. Also, try to avoid contact with bird or bat droppings. These droppings are a common source of the fungus, and disturbing them can release spores into the air. If you find them in or around your home, remove them carefully. It's important to handle these materials with care to avoid releasing spores. wear gloves and a mask, and clean the area thoroughly with a disinfectant. This will help to kill any spores that may be present and reduce your risk of infection. By taking these precautions, you can help protect yourself and others from histoplasmosis. Section 8. Seeking medical advice. If you suspect you've been exposed to histoplasmosis, see your doctor. Early diagnosis and treatment are essential, especially if you have a weakened immune system. Your doctor can determine if you need testing or treatment. They can also provide guidance on preventing future infections. Section 9. Conclusion. Histoplasmosis is a fungal infection that can cause a range of symptoms. Most cases are mild and resolve independently. However, severe cases can be life-threatening. Early diagnosis and treatment are crucial. You can reduce your risk of infection by avoiding exposure to the fungus and taking precautions when working in areas where it's common. Stay informed, stay safe, and stay healthy.